Okay, well, we are going to jump in to be respectful of everyone's time. Again, my name is Linda Madison. I'm one of the 2 deputy county managers for Los Alamos County, and we want to welcome all of you to a community briefing on COVID-19. Thank you so much for spending some time with us this evening. This briefing is a result of a great suggestion from one of our community members in asking the county to have this kind of briefing modeled after the briefings that we had during the fire, our recent fire, the Cerro Pelado fire. So we were more than happy to accommodate and are excited to try and be as informative and get some information out to all of you. We are really excited. We've brought together a panel of local experts, and we thank them first of all for being here and spending some of their evening with us tonight. So I will start by introducing our panel. First of all, we have Dr. Will Athas. Dr. Athas comes from, sorry, excuse me, he comes from us he's worked for the New Mexico Department of Health. He's worked at the UNM most recently, where he's retired. And what's exciting is that Dr. Athas has also done work in Los Alamos proper. In 1991, he led several epidemiologic studies on cancer incidence among populations living in proximity to the national lab. So he knows our community and he's familiar with us. So he is doing some work around COVID, and we're super excited to have him with us tonight. We also have with us local pediatrician, Dr. Ben Neal from the Children's Clinic. Thank you so much for being here, Dr. Neal. I think everyone knows Dr. Neal, so I don't think he needs further introduction. We also have Jennifer Guy, who is currently the Assistant Superintendent for the Los Alamos Public Schools. Most recently, Jennifer served in the acting capacity, the interim capacity, after Dr. Steinhaus retired as superintendent. So she was the acting superintendent for almost a year, if I'm not mistaken. So again, welcome, Jennifer. We also have Beverly Simpson. She is our emergency services commander with Los Alamos County. Most people will recognize her through her tireless efforts through this pandemic, also through our fires, all of our emergencies. So thank you, Beverly, for being here. And finally, we have Joyce Richens. She is from the Los Alamos Medical Center. She's the infection prevention and employee health nurse. She's a longtime resident of Los Alamos, and so we're excited to have her with us tonight. So I wanted to just show you a little bit of what we plan tonight. We really anticipate that the bulk of this evening will be just an open question and answer period with our panel members. But we're going to start that with asking Dr. Athas to give us, kind of set the stage, give us the current COVID case numbers, show some trends, and give us just that baseline so we can kind of go from there. So with that, I'm going to turn it over to Dr. Will Athas.
Okay, well, thank you, Linda. Can you hear me okay?
Yes, we can.
You can? Okay, very good. So over the last couple of months, I've been working with the county, basically doing surveillance on COVID-19 in the county, and primarily looking at incidence rates, case numbers, and age-specific incidents. So as Linda mentioned, I've worked in the county before doing health studies, so I'm familiar with the demographics and whatnot. So this chart here is basically showing the 7-day average daily case counts. Daily numbers jump around quite a bit, so oftentimes we use 7-day averages. DOH, NMDOH, and CDC use those as a standard sort of statistical measures and metrics. And that's what's being shown here. The data here is going back to November 9th, or the week ending November 9th, 2021. And basically, I'm just showing sort of the pandemic curve for the county over the last, whatever that time frame is there, 7 or 8 months. And we've gone through successive waves of the variant in the county as well as elsewhere. Delta was prevalent last summer and bled into last fall. And then we had this huge spike of Omicron variant, the so-called BA.1, which is quite dramatic in terms of its influence. Large numbers of cases. So in Los Alamos, it was getting up to, on average, 80 to 90 cases a day being diagnosed with Omicron BA.1, and that didn't last too long. So we had this sharp peak, which was basically observed everywhere throughout the US. And then a rather rapid decline, and then a replacement of the BA.1 variant with a successive set of Omicron variants or subvariants. The next one to come along in February and March, April was BA.2. And you can see that the number of cases really dropped down then. And we were hoping that we'd stay sort of on the deck for quite some time, if not into the extended future. But you can see that there started to be a gradual rise in case numbers around the mid-April timeframe. And that rise continued in a rather gradual fashion as some new variants came into circulation, particularly the so-called BA.2.1 and more recently BA.4 and BA.5. What was a little concerning was, and I'm sure people in the community anecdotally recognize this, that beginning around the beginning of June, just 3 weeks ago or so, case numbers started to pick up. And you can see that increasing trend line there at 1st of June. It peaked, where it appears to have peaked at least around mid-June, the week ending mid-June. And over the last week or so, case numbers have been trending down. So that's kind of where we're at right now. I think there's been some concern in the community because of this uptick in cases. It has been seen elsewhere. We don't really have an explanation for this per se, but that's kind of where we're at now. I've done a little bit of work to try to figure out what actually may have been happening during this this smaller peak, if you will, in early June. And if you'd move to the next slide, please. So this just shows what we call age distribution of cases. These are actually incidence rates. So they express or show the actual risk of infection, or at least a positive PCR test, if you will. Age goes across the bottom axis there in various different age categories, starting 0 to 4 and then ending up with 80 plus. The blue bars show the incidence rates back in March when the incidence was relatively low, as you can see. And then the red bars show the most recent sort of case peak in June. And what I was interested in here was seeing whether there was any particular age group which sort of disproportionately contributed to the total caseload being seen in the county in June. And as kind of you can see here, there really wasn't any obvious standout age groups. What I was a bit concerned about was the very young, 0 to 4 years old to the left, as well as the elderly, 70 and 79, 80 plus. I was hoping that those rates would be relatively low compared to the other age groups because they tend to be more at risk at the extremes of the age grouping here. But in fact, the risk levels were relatively similar to middle-aged adults and teenagers. To me, this perhaps suggests that there is, or at least was and is perhaps still ongoing, fairly wide community transmission of the virus to affect all of these age groups in a relatively similar risk profile. That's typically a conclusion epidemiologists would reach with communicable infectious disease of this nature. So that's basically the 2 points that I wanted to show for what I'm talking about here. As I alluded to earlier, we don't have any particular answers to what's happening in the county. We've looked at what's happening in other counties as well as elsewhere in the nation. And a lot of this is timing and the introduction of new variants when they were introduced into a given population. Los Alamos is a small, relatively small population, relatively contained. And one of my concerns would be as if these very transmissible and highly immune evasive variants like BA4 and BA5 were introduced fairly early into the county. That certainly could account for some of the trends that we're seeing here. Unfortunately, we don't have specific data on the variant proportions which comprise the cases in the county. So we can speculate on that, and maybe somewhere down the road, we would have some information to further comment on that, but at this point, we don't. The good news is, as you saw on the prior slide, is that the case numbers are coming down. So hopefully that trend will continue. I'm guessing that we're going to see this play out perhaps in other counties in New Mexico, as well as other areas of the US, in which case it may just be an indicator that Los Alamos was kind of influenced early on by some of these newly circulating variants. And in that regard, if case numbers continue to trend down, then hopefully we'll get back to where we were back in March and April, getting back down onto the deck and into a steady state situation. So I think I'll stop there, and there'll be time to answer questions, however you want to do it, Linda, now or
Thank you. Yes. We do have a question of you, which I think we might as well take since the charts are real close. And that question is, the chart shows the reported cases over the last few months. What do you think the real number of cases was or is?
Yeah, that's a question all epidemiologists working in COVID are asking themselves, because we generally don't have an answer. The reality is that just looking at PCR testing likely reveals the important underlying trends. The absolute rates are likely higher. How much higher, it's hard to estimate. But from an epidemiologic point of view, we can assess trends as we just saw here. It becomes more tricky when we compare across different populations, not knowing, say in Albuquerque, the prevalent use of at-home antigen testing versus that in Los Alamos. And so it becomes difficult to compare somewhat across geographies, but within the county itself, I think we can clearly see there's been an increase. And even without having information on the at-home testing use, we can still see that there's reason for concern there.
So we're going to continue with just a brief opening statement from the rest of our panel. We're going to go to Dr. Neal. And Dr. Neal, we were hoping that you could just give us a little bit of information about the new approved vaccinations for 0 to 5, vaccinations for other, 5 to 18, and then also if you knew when those vaccinations for the 0 to 5 would be available in the community.
Okay. Just briefly, I'd like to talk a little bit about the graphs we were seeing, because we certainly were seeing that in the clinic starting mid-May, about the time all the kids were getting together for parties and graduation. We started with the teenagers coming in, then the families coming in, and then the children coming in. And it is dropping off, but it's still pretty steady with the number of COVIDs. And I would say that probably the underreporting is anywhere from 3 to 4 times, because you have families that everybody's testing positive on their home thing, and the babies are coughing. And so they come in, not so much to be diagnosed with COVID, but to see if there's a problem with their oxygen and stuff like that. So you'll have a family of 4, everybody's positive, but nobody's reported, except for if we do a test on the baby. So that's just my comment on the graphs with that. As far as the vaccine goes, of course, there's 2 vaccines for there's 2 vaccines for everyone now, because the Moderna has been approved for not only the 6 months to 5 years, but now has been approved for the 5-year to 12-year. Previous to that, it was just the Pfizer vaccine with that. And so you have vaccines available, parental or personal choice of which one you want to get. So just briefly, I'll talk more about the 6 months to 5 years. The Pfizer vaccine is a lower dose of the one that has been in use. The adult dosing is 30 micrograms per injection, and the 6 months to 5 years is 3 micrograms. So it's 1/10 the dose. And the side effect profile is actually quite good. Some local reactions, less than 10% of the recipients are reporting citing injection pain and some fevers. And our experience in the clinic with the older kids has been practically 0 reactions with that. And that doesn't mean we get reported on everything, but at least the reports back we get have been pretty positive. The efficacy of the Pfizer vaccine is anywhere from, well, for severe disease, and so that means preventing kids ending up in the hospital is about 90%. From preventing mild disease, it's only about 30 to 40%. So it's very much like the flu vaccine, in that it keeps you from ending up in the hospital, but you could still get, particularly with all these different variants coming out, because this is based off the initial COVID vaccine and is not specific to the new variants. But in our viewpoint, keeping them out of the hospital, if this is just a mild disease, we're happy with that. At our clinic, we will be doing the Pfizer because of the lower dose and the lower rate of reactions. And actually, our first clinic is tomorrow for that. And I believe it's all booked up already. So the vials, the vaccine comes in vials of 10, and it's only good for about 8 hours. So we have to cohort people coming in so we don't waste it, which has been a huge problem in this country. I mean, we've wasted something like 80 million doses of the vaccine, which is a shame considering the rest of the world would love to have it with that. And then the Moderna is available. There are places in Albuquerque, and I think there's a couple in Santa Fe that are doing the Moderna. It's a higher dosing. It's 25 micrograms of the mRNA, and or at least a component of the mRNA. And it's a 2-dose, oh, I should say the Pfizer is a 3-dose shot. So it's, you give one, then 3 weeks later, then 2 months after the other. And so that's a little inconvenient, but because of the lower side effect profile, we thought that was better. So that's what we're doing. The Moderna is a 2-dose regimen and gives very similar efficacy. And the side effect profile slightly worse, with a little bit more fever, a little bit more side effects. And most adults who got the Moderna would agree that if they got the Moderna, they tended to have a few more achy nights than with the other, but that's not 100% by any means. It's a good vaccine. They all seem to do what we really want them to do, is to keep kids and people out of the hospital. And that was seen with that Omicron surge in January, where in Philadelphia had one of the first surges. And there was all this concern because with the Delta variant and the original variant, you would see the surge of illness, and then 2 weeks later, you would see a surge in the ICUs. And that's why Philadelphia reinstituted its mask mandate around that time. And as it turned out, they had the surge in cases, but not the surge in ICU admissions because the vaccination. It's estimated between disease and vaccination that we're probably at about 92% immune rate. Unfortunately, these new Omicron variants are capable of avoiding our immune system somewhat. So that's why you keep seeing these peaks. In the 5 to 12-year-olds, like I said, not many side effects, pretty efficacious. The kids we've seen have been minimally sick. And the ones that have had the highest fevers are the unvaccinated, but even they have been minimally sick. The number of deaths in children from the COVID vaccines has been about 1,000, so a 0.1% death or severe illness rate. So kids tend to tolerate COVID, whether you're vaccinated or not, and just tend to get over it. And the other advantage is these school kids are less likely, at least that's what I've been reading, to spread the virus if they do get it. They have a lower viral load. And of course, the big concern is the adolescents, particularly the males that are between 12 and 27. There is a small number of people who have the myocarditis or inflammation of the heart muscle, of which 95% of those recover without any issues. The rate on that estimated is like 15 cases per 100,000, whereas the most recent thing I read about myocarditis in severe COVID, that means hospitalization is 1 in 8 from the disease. And so when you look at these risk and benefit, you just have to look at risk and benefits. And we have yet to see anyone with that kind of complications. Does the vaccine have complications? By all means. And we can't identify everything. And I hear people that have had some issues, but the majority do fine with that. So that's my take on it.
Great. Thank you, Dr. Neal.
My pleasure.
We're going to go to Jennifer Guy to give just a little bit on the schools.
Good evening. Thanks for having me. School Scout for summer. We finished the school year with almost 4,000 students on campus. We are having some summer programs that started on June 13th. So currently today we had 202 students on our campuses. So a very small number compared to what we had in the school during the school year. A lot of those services are for things like speech or occupational therapy or other things like that. But we do have a regular summer school program going, and we have a program at the high school. For those programs, we did require masking indoors for all students because at the time, as you can see from Dr. Athas's graph, at the time we started summer school, we were seeing that community increase in cases. So we are requiring masking indoors. We've had 1 teacher and 2 students have report positive cases to us from our summer school population. And so of those, one of the students was never on campus while they were infectious. 1 teacher and 1 student were on campus. We haven't seen any more. They both reported the first week, and we haven't seen had any more cases reported since then. We will continue we've got air purifiers in classrooms, things like that now. So we're going to continue with the safety protocols we've got in place throughout our summer programming. We will get direction from the Public Education Department. Another COVID toolkit, we expect that out before the end of July. And that'll inform some of our practices going into the school year next year. So in the meantime, everybody's we're gonna have to all wait and see what the Public Education Department tells us to do. We will also continue to watch community spread and the cases in our community to make any determinations on how we start school this fall. We've had, just for those of you that are curious, I know we've heard a lot about cases in the community since school was out. In addition to those summer cases, we've had reported to us 14 students and 3 staff members, but they weren't ever on our campuses over the summer months. And that's all that's been reported to us so far this summer. So I'm happy to answer any questions though.
We have some questions for you, but we're going to finish our quick overviews and then we'll start the questions. So thank you, Jennifer.
Sure.
Next, Bev Simpson, if she's going to give us just a couple updates on some things within the county.
Thank you. It's been a while since I reported. So in the last 2 months, we have actually as a county seen an increase in 700 cases. So with the ebb and flow of that, with the different variants, as was mentioned, that it's a little bit high. We're at the medium as far as our county. But we continue to vaccinate individuals. I ran the numbers earlier, and in the last 2 months, the county, thanks to everyone participating in this, has provided over 3,721 vaccines to the community. So that actually lifted us up to, with the individuals, the kids actually 5 to 17 years old, we're at 69.9% fully vaccinated for those individuals. The booster shots, it's on par with what the state is reporting. About 25% of those eligible have received boosters in that age group. As far as the adults 18 and over, we're at 69.9% have received their boosters. There's LAM, I wanted to report, I don't know if Joyce was going to hit this, but currently LAMC has no inpatients with COVID, which is a fantastic thing for our community. Our fire department continues to provide vaccines to those that are homebound or individuals with mobility issues, and that's coordinated through the county social services department. So yeah, I want to just to touch briefly on just the important things. It's been reported individuals have been having issues with registering for the upcoming clinic, which is the 27th over at the First Baptist Church. That is actually from 3 p.m. to 7 p.m. So we could catch individuals after work. We know it's hard to get to these sites through the daytime. I want to shout out to Pastor Taylor for allowing us to use his facility. As you scroll over with that registration, when you go to the site locations near me, you actually have to click on one of those blue buttons to choose the First Baptist Church. There will be directions on the webpage, but we do have information on the website that talks about everything as far as DOH's new guidance, CDC's, what's going on in the community, information like that. We continue doing the curative and the pathology consultants testing in every day down here at Overlook Park for pathology consultants of New Mexico. You are not required to have an insurance card. They do take Medicaid and Medicare, but if you are out of country, I know there's a number of individuals visiting from other countries, the cost is $99. But Curative has stated that they will take individuals without insurance. And so as I continue to get feedback on that, I will pass the information along. And I believe, honestly, that's probably the high points most important, working with Premier Medical to set up vaccination clinics for the under 5, and that will be both vaccines. And so that coordination has started. They are ordering vaccines. So more information to follow on when those will be available and when we will be holding the vaccine clinics for the under 5-year-olds.
Great, thank you. Thank you, Bev. And that may answer a couple of our questions about that. So last of our panel is Joyce Richens, and if she would give us just a quick update from the hospital.
Thanks, Linda. Yeah, thank you for having me here. So as far as our hospital has been going through this pandemic, we've had different levels of protection and restrictions. At this point, we are open and we have all of our doors open. You can go through the basement doors, you can go through the physical therapy doors, the front doors, the back doors. So we are open. We do ask that people wear a mask in the hospital. We will provide it if you need one. Also, if you have symptoms and you're coming to visit a patient or an employee or just the gift shop or whatever, we're asking you that you refrain until you are feeling better. We kind of along with what you've heard, the trend for as far as patients that we've seen, our numbers, we did have a little surge the last probably 2 or 3 weeks, and lately it looks like maybe it's going down. It's a little early to tell. We feel like a lot of the patients that we have seen maybe aren't quite as severe as the patients that we saw early on in the pandemic. So yeah, hopefully that's a sign that vaccines are working. And a lot of the patients that we've seen seem to have the underlying conditions, diabetes or other comorbidities. So as Bev reported, we don't have any inpatients at this time that have COVID. For our staff, we are following CDC and the public health order from our governor. We encourage vaccination and the booster as well. We have systems in place that monitor and have our staff report any symptoms every time they come into the hospital, or if they're at the hospital and they're having symptoms, we ask them to report to us, and we can get on it and do what we need to do soon, immediately if we need to, have them either leave or we can test them and that kind of thing. So let's see. I think that's kind of an overview, and I can answer questions as we go along. So thanks.
Thank you. So I'm going to reach out to Julie Williams-Hill, our County Public Information Officer, and we will try and ask some of these questions that we have going. We have a few in the chat bar. Oh, I'm sorry, Julie.
Did you want me to share the senior center?
Yeah, before we do that, sorry, one more thing, and we'll flash this quick, but I did. We were not able, Bernadette Laritzen from the senior center was not able to join us tonight. And so she did just want to give some highlights from their organization. The one I wanted to highlight was they are currently requiring face masks to enter their facilities. They started that while we were in this current surge or wave. And right now it is scheduled through almost the end of the month, the 28th of June. And they're evaluating that week by week as they look at the numbers and such. And so you'll just see that they have been very instrumental in getting the vaccination clinics, distributing COVID test kits, providing sanitizer and masks to community members. And they report to the Aging and Long-Term Services and the area agency on aging. So they, have other restrictions and requirements. And they have been, really stepped up in providing more home delivered meals to people who may just don't want to come to a congregate meal setting. And they've been providing free grocery and prescription services to members who, don't want to come in or don't feel comfortable taking some of those. So they've been very active throughout this pandemic. So with that, we will open it up to questions, and a lot of you have already started. So there is a Q&A spot for our attendees. The other option is that you also, if you're able to just use the raise your hand function in Zoom, we will also take some verbal questions. So Julie, let's start with some of the ones, the early ones in the Q&A box.
Sure, Linda. So we have a question for community spread. Can you determine differences among workplace spread versus spread at schools, events, or churches? Is that something, Dr. Athis, that you're able to answer?
Well, I could provide an answer, sure. Thanks for the question. The short answer is not very much. We certainly can look at age, specific incidents, as I showed, and that gives us an idea of working age adults and the very young school age children and whatnot. But as far as collecting any data on actual infections and cases, the state does not do that. There's no program in the county to do that. So we really have no way of linking people's exposure setting or their some other characteristic with their positive PCR test. And that's a great limitation epidemiologically, but that's unfortunately where we're at.
And the only thing that I'll add is that I know the schools and the county for our staff members, and the schools may do it also for students. When they do contact tracing, there may be anecdotally where people maybe thought they, were exposed. But for sure, the county, we don't have any, strict, following every close contact, every case. So there may be anecdotally where maybe a couple of people said, oh, I was somewhere, but not anything specific. Jennifer, do you have anything else to add?
Yeah, that's exactly. We interview everybody that reports positive. I would say just, without telling most often what we hear is a parent was on travel or the family was on vacation. Travel's typically, someone in the family traveling is typically where it seems, where we see the most cases coming from, but not all of them.
Great.
And I might add that the consistent data streams we have for case reporting are being provided by New Mexico Department of Health, as well as the Centers for Disease Control. They collect just a very streamlined set of data. So there's clearly other information sources locally that you could anecdotally reference, whether it's the schools or workplace requirements and that. But as far as the day-by-day data streams that we're getting from health agencies, it's quite limited.
Thank you. Okay, Julie, next.
So the next question is, they ask, is now an appropriate time to get the second booster shot? Earlier this spring, our family doctor recommended waiting a bit since we had several vaccinations, pneumovax, flu, Shingrix, etc. Anybody want to take that one? Is that
No.
Joyce or Dr. Neal?
Yeah, this is Deb. How long has it been for that individual? That would be my first question for the booster.
So, anonymous attendee, do you want to raise your hand and provide a little more context to your question? Okay, hold on just a second. So your hand was raised for a moment and then it disappeared.
I can probably, at least from the pediatric standpoint,
Oh, here we go.
there's not been any contradiction indications for kids that have received their other vaccines to have to wait to get their either first or boosters on the COVID vaccine. So we tend not to wait. There is some question about if you've had COVID, should you wait? And there's recommendations all over the place, but no scientific evidence of how long to wait on that. As far as timing on it, COVID is still considered to be a winter disease because of the people going indoors and being closer, though obviously that's not necessarily true looking at the present surge. And so I think most people say you may want to be a little closer to the fall if you're going to get it, or of course, if you're traveling or going to be at a high risk exposure, or if you have high risk disease, you don't want to wait on that. So unfortunately, I can't give you any scientifically based information on what's the ideal timing on it. And again, I'm a pediatrician, so I can't speak to the elderly, which I have apparently been told I am by some of my patients. So.
And again, it sounds like you were having a conversation with your primary care physician. That may be the most appropriate place for that question.
So Ms. Doyle is unmuted at the moment. So Ms. Doyle, if you'd like to expand on your question.
Yeah, sorry, I was having some glitches with unmuting and muting and all that, but yeah, I got my booster in October, at the end of October. So I'm assuming that it's probably a good time to get it. I mean, it's the rise in cases is a concern. So
Yeah, and again,
I was getting Moderna. I've had the
it sounds like the best person to ask is your primary care physician.
yeah. Okay.
Okay, thank you.
Thanks.
Okay, so we do have another.
Sorry, this is Bev. I'm sorry. So per the Johns Hopkins, a second booster can be given 4 months after the first booster.
Perfect. Thanks, Bev.
Okay, so we have another person with their hand raised. If we want to take another.
Sure.
Okay. So Ms. Copeland, if you'd like to unmute yourself.
There we go. I was wondering if the county had a place that we could look at the wastewater data information. I know that the CDC reports some of it, but they won't report the information from White Rock because it's so small and things like that. And I just was wondering if we could get that information. And then I just real quick had a second question. If kids are able to get a Moderna booster now, the over 5s, now that it has been approved. Thank you.
Okay. Dr. Neal, I'll defer that second question to you, and then I can address the wastewater surveillance question. You're muted still.
It's muted.
Could you repeat the question, please?
Now that Moderna has been approved for the older children as well, can can like a 7 or a 10-year-old get a Moderna booster?
Yes, you can cross different vaccines apparently with that. I haven't looked closely at that data, but the last thing I read was that there is not an issue with that. Again, we don't carry the Moderna at this point.
But will one of the clinics that the county is running have that available? for
Yeah.
Moderna booster?
Yes, we will have both Pfizer and Moderna at the upcoming June 27th clinic, and anyone over the age of 5 is eligible.
Great, thank you, Bev. And just to address Ms. Copeland's question about the wastewater data, she is correct, the CDC, we are in a program with them for wastewater surveillance. We actually take data for both our treatment plants, Los Alamos and White Rock, but she's correct, the White Rock one, the population is too low for it to show up on the CDC data. Data dashboard, I guess I should say. And so I will, let me take that as a question back to, if they're actually, what they're doing with that test data. Even so since they're not reporting it on the dashboard, can we still get that? So thank you so much. I'll take that question and we'll try and have that answered and put out that information. Julie, you can go to the next question.
Sure. So the next question, is there a sense of how many people in Los Alamos County have been reinfected with COVID? Any people who have had COVID 3 or more times?
Dr. Athos, is there any collection of that sort of data?
Right. Well, again, no, not with the formal data streams. The state health department does have access to that information because they have individual identifiers which come in with the positive PCR tests. And so they're able to identify multiple infections, but they don't report that data. And I have yet to see any reports about the prevalence and just the occurrence of multiple infections. I think it's probably safe to assume that some people certainly have had multiple infections. And one of the big concerns with this new set of variants, BA4 and BA5, is that they're sufficiently immune evasive towards antibodies which have been raised either by vaccine or by prior infection with the original Wuhan strain or Delta or any of the other initial Omicron strains, that that these new variants are sufficiently immune evasive that it's going to be easier for people who were prior infected and do have some antibodies to still be reinfected. Where that's going to go, we don't really have any leading data right now.
Great, thank you. Julie, I'm going to quickly, I see a question. Is the COVID vaccine going to be required for students in August? Jennifer, you want to answer that one?
This time, we do not believe so. We expect final guidance on that at the end, but I don't expect it to be required for sure for this next school year. Dr. Neal, do you have any different information on that?
I do not.
Yeah, we don't expect it to be so.
Great, thank you. Sorry, Julie, I jumped ahead.
Oh, that's okay.
And I know that there's a question about signing up for that June 27th vaccine clinic about an event code. So if that person at the end of this this meeting will stay online, we will try and work with you to get you signed up. If you'd like to sign up for that vaccination clinic, we'll do that, but it's too difficult. I think it's just too difficult to try and explain it right now. So I saw that question. Okay, Julie, sorry, I'll let you ask now.
Okay. So the next question is, can the county mandate masks and vaccines?
Huh. Who's my lifeline on that? I guess it would be a legal question for our county attorney, whether we would be able to. So I can take that as a question to our legal.
Okay. For the next question, is this your only answer? More vaccines, more masking? Have any of you seen the data from, I'm not sure what VAERS, US military data and data from other countries? Now the answer, now your only answer is the same or is more of the same except to vax babies and children as well. I'm not certain if someone can answer that question. Seems perhaps more just a statement.
Sounds like it is a statement. Yeah.
Okay, so the next question, Los Alamos County is yellow, closer to red with unreported cases. My parish requires masks. The schools, summer students are wearing masks. Why is the county not more proactive in requiring masks during this surge?
We are constantly evaluating whether we should recommend or highly encourage masking. And that is probably something that may happen if we do, move over into the CDC community level red. So that is something that we talk about and can contemplate. Maybe not mandating, but definitely highly encouraging that mask wearing.
So next question, how serious is the risk of COVID to pregnancy at 36 to 37 weeks? My daughter had her second booster 2 weeks ago, but now has been exposed within her family. How serious is this risk to her? Should she isolate from her family?
Joyce or Dr. Neal, is that anything you can answer?
All I could, I certainly don't have all the information for obstetrics, and she probably should talk to her doctor on that. I mean, the better part of valor would be to isolate from her family, or at least mask and have everyone masked around her. There have been cases of infants born with COVID or getting it soon after, and then there's some issues which I'm not real familiar with, where the obstetricians, if you have had COVID, are a little more aggressive with pushing up deliveries and things like that. But I can't. So I would refer you to your OB.
And I would just add that we know that vaccines are encouraged in pregnancy and that they have been proven to help with the spread and minimize the infection as well. So.
Great, thank you. Next
Our
question.
next question is, when will schools have Hipaa filters and CO2 monitors?
Answer that. We actually already have those things in place. All of our HVAC systems in all of our schools have automation features that allow us to set how much outside air comes in. They adjust. We have CO2 monitors on all of the systems, so we can either manually adjust those. We can set them so they automatically adjust. During COVID, we have allowed in more outside air and increased the circulation rates. And we've already meet the highest level of filtration. So we meet all of those standards in all of our schools. In addition to that, with the help from the county, this year we now have purchased air purifiers with HEPA filters for every occupied space. So every classroom space in the district this summer and going into next fall will have an air purifier in the classroom in addition to that.
Great. The next question is, could you please address natural immunity?
Doctor.
Natural immunity is effective, but it does wane. I've read articles where they find neutralizing antibodies, at least in the initial wave of COVID, that lasted from 100 to 300 days. And it was variable, and it depends on the person because everybody responds differently to different diseases. So 100 days is 3 months to 10 months. But what is thought is that, like the vaccine, that after 5 to 6 months, you are most likely vulnerable to whatever else is out there. And of course, with the shifting in variants, like Dr. Athos said, that they are immune cloaking. They can avoid your immunity somewhat. Though, again, I would like to stress that the vaccine is meant to prevent serious illness, not the I don't feel good for 3 days. Which is again what we're seeing in the clinic, is the kids are sick for 3 to 5 days and bounce back very quickly.
Dr. Athos, did you have anything you wanted to add?
Only just to repeat again that what's the great challenge here on all sides is the changing in the virus and in these successive waves of variants. If the virus would settle down and stop changing, we'd be in a very much better place and a much more steady state place. But the issue is that every couple of months, the new variants emerge with more robust characteristics, which challenges. At the same time, the general population is pretty tired of all this, but the virus right now is not tiring out. And that is our challenge, is to keep on top of the virus and hopefully keep people aware. But so in that regard, natural immunity is relative, because if the virus wouldn't be changing, then one infection would provide a lot of help. But as the virus changes, and again, with these new variants which are coming along, past infection, so-called natural immunity, is much less effective than we would hope it to be. So it's important to bear in mind that even though you've been infected before, you can still get infected as new variants emerge. And that's a very important thing for everyone to bear in mind.
Great, thank you.
Okay, so the next question, are the reinfections causing hospitalization? Is the symptoms of the newest mutations as severe as the original Omicron versions?
Well, I'll take a stab at that. Again, as the virus changes, it attacks the body in somewhat different ways. There's some concern that this current wave of BA4, BA5, which is becoming predominant here in the US, has more of a tendency to invade lung cells, kind of like the original Wuhan strain or the original virus. Most of the Omicron variants have been infecting nasal mucosa and basically lingering in the upper respiratory tract, causing congestion and cold-like symptoms. But there have been a few laboratory studies showing a greater ability for the BA4 and 5 to infect lower lung tissue. And that was the big concern with the early forms of the virus, because that produced severe pneumonias and ultimately hospitalization and death. As far as the actual clinical side of things, that's not something I could comment on in terms of hospitalization and that sort of thing.
I can tell you that hospitalizations are significantly down. I recently talked with the ICU doctor down in Espanola, and really all they're seeing, the few hospitalizations they've had have just been for oxygen, not for intubation. And so what we're seeing right now, the numbers going into the hospital are less, and the severity is less with whatever variant we have in the area right now. So, and I believe the same thing's going on at LAMC and at UNM, of course, which is the major center for really sick people. And it's still happening. Some people get very sick with this and deaths still occur. I mean, I don't want to downplay that. It's just not at the levels we were seeing with the Wuhan variant and even the Delta.
Yeah. I might add there's some international data, particularly from Portugal, which has gone through a large sort of BA4, BA5 wave now, and they did see some increased hospitalization in their population as those cases wave went through. The same thing happened in South Africa with the BA4-5 wave, but they did not see nearly as much rise in hospitalization. So it's a little hard to project based on what's been seen internationally. And we're right sort of at the cusp of this BA4, BA5. I think there is concern in the general public health community that we could see somewhat more severe disease, but we do have better treatment now. And that's very different than at the beginning of the pandemic. So that's the good news. So it's important for people, if they do become infected, to avail themselves to the oral antivirals and other treatments which are out there.
Perfect. So I think we have time for just maybe one or two more questions. I know there was one about if masking was required at the YMCA program at Barranca. Is that, sorry, is the YMCA program at Barranca masking like summer school?
Yes, we always partner with the YMCA because they co-share a facility. So whatever the schools do, they follow suit. So as long as we're masking, they'll mask. If we close, they'll close, etc. So yes.
Ms. Copeland, I hope that was your hand was up for that question. And I'm just looking real quick to see if there's one more we can do at the very end. I don't. Again, does the county have any information on the prevalence of long COVID cases? That's a great question, and we will try and address that in our newsletter. And I think that's a great segue into trying to just kind of wrap up. And we have a couple questions, like I said, that we will take, and we will try and incorporate those into our weekly newsletter. First of all, I just want to thank our panelists, Dr. Athos, Dr. Neal, Jennifer Guy, Beverly Simpson, and Joyce. Thank you so much for taking time this evening. It's super informative, and we appreciate you being available to us. And thank you for that. And then secondly, I just want to reiterate a couple things from the county point of view. Like I said, we do have Julie, if you just want to show the one slide, some of our resources. Thank you. One more. Okay, so remember, there's subscribe to our COVID newsletter. If you want, we have information on our website about vaccination clinics, testing, all kinds of information. It's a pretty easy lacnm.com/COVID. That takes you to that page, and just lots of good information. Don't forget, the vaccination clinic is scheduled for the 27th. And again, that information is on that website. I will ask that the person who had some problems registering, if you want to stay on as everyone leaves the meeting, we will try and work with you, or at least get a phone number where we can call you tomorrow to get you signed up for that vaccination clinic. And lastly, again, we'll put this in our newsletter, is we really are urging everyone, to get current and accurate information about COVID. We really want to use reliable sources. And so we've put together a great list of resources and sources, websites that are, reliable and accurate. So this is our list, but like I said, we will put this out. Again, we are trying to get this information out to our community. So again, with that, I want to thank you all for attending, and please have a nice evening and a great rest of the week.